Welcome back to the Health Marketing Collective. I'm your host, Sara Payne, and I'm bringing you fascinating conversations with some of the industry's top marketing minds. Today, we're tackling a deeply sensitive issue, the tragic killing of UnitedHealthcare CEO and what it reflects about the trust in healthcare. First, I want to extend my deepest condolences to the family, friends, and colleagues of Brian Thompson. This episode isn't about speculation, but reflection. Trust in institutions, healthcare, government, business is eroding. And this tragedy compels us to step back and reflect. What's happening in our culture and in our industry that brings us to this moment? And most importantly, how do we move forward? For marketing leaders, this is personal. We navigate corporate priorities while being patients ourselves, parents, and caregivers. Joining me to explore how we move forward is Jon Austin, a veteran consultant in crisis and issues management. Jon, there's no one better to guide us through this conversation today. Thanks so much for being here.
Well, thanks for having me, Sara. Probably no one better who's available, but I'll take the compliment anyway. It's lovely to be with you, and I just want to echo it. We're here to talk about a tragic situation, and we want to do that with respect, and we want to do it with dignity, and we want to do it without causing any more pain than already exists around this situation. So with that as a caveat, let's just try to frame the discussion and see where we go.
Yeah, well said. We're gonna do our best to approach this with care and humility. The healthcare industry is uniquely positioned at the intersection of people's health, finances, and emotions. So when trust is absent in the equation, the stakes really couldn't be higher. So, Jon, let's start by talking about some solutions here. As marketers and leaders in healthcare, how do we go about rebuilding trust?
Well, I think you have to recognize that it's a relationship, that you have not just a series of transactions with your customers and with your members. You have a relationship, and relationships come with a different set of expectations than transactions. A transaction is a drive-through experience, right? And if you have an unsatisfying drive-through experience, well, that's a momentary disappointment. But if you have an unsatisfying relationship, particularly as you said, a relationship that is so much at the core of people's lives, and there is very little that's more central to people's lives than their healthcare and their health. And especially if it's their children's health, then you can add a magnifying factor to that. You really, I think the first thing is look at, are we treating this like the relationship our members expect us to do, our constituencies expect us to, and are we organized to deliver on that service? Because I've met a lot of people in this space, a lot of healthcare professionals, all the way from providers to payers to device manufacturers and things like that. And almost to a person, I can tell you, they care. They care about what they're doing. For some of these folks, it's a calling. And so it's not a lack of care. It's not that people are insensitive. It's how do we deliver a valuable, scarce commodity, because it is a commodity and do it in a way that respects the relationship. So I think that's the starting point.
Yeah, I agree with you. And, we were prepping for this conversation and really talking about that it's moments like this where there's opportunities to really make a difference and make sure that we're saying something that truly matters and sort of leaning into that, stepping into that conversation, right? There is distrust, there is some pain that's out there. And I think as brands, as companies, as marketing leaders, we have to step into that. We have to be willing to step into that and give people the information that they're looking for.
That's exactly right. And I'll just widening the frame just a little bit for a minute beyond healthcare. I get called in on a fair number of what are legitimate crisis situations. They are the awful things that you pray never happen. They provide no benefit. They have nothing about them. They're the things you never want that keep you up at night. And yet they happen. They happen in every business an industry in America experiences those events sooner or later. And what I tell people when I come to them is that within that awful, terrible moment, there is an awful, terrible opportunity, because at that moment, your constituents, your employees, your members, your business partners, the entire constellation of people who care about your organization, they are paying attention to you like never before. Like as marketers, you wish you had as much of their attention. Well, in an awful, terrible, unwelcome way, you do have it right now. And so part of the process of responding to a crisis is we have their attention. What do we want to tell them? What do we want them to know about us? What do we want them to know about this moment? What do we want them to know about what we're going to do with this moment from forward? Because even the most awful, terrible moment will pass, and that attention will start to trend back to normal. But right now, right there, everybody's paying attention, and they really, really want to know, want to hear from you. So, sometimes you can't seize that moment, but it's there.
That is so well said. Such an important point. I think people would do themselves a favor to actually roll that back and listen again, because I think that cannot be underscored enough in terms of the importance of that, and really stepping into that moment and saying the things that people really do need to hear. And especially right now, because there's a lot of fear amongst, rightfully so,
yes,
corporate leaders, corporate executives, rightfully so. There is some fear about their own safety and security. And obviously that is an important thing to make sure is taken care of, but we cannot let that fear prevent us from stepping into this moment and providing the information in a very transparent way that people are looking for. Tell me what I want to know. Talk to me, help me understand better what's going on here. I think we cannot let that fear prevent us from stepping into the moment.
And I think we're worth acknowledging. I suspect most of your audience knows that on a very personal level. I suspect if you're listening to this or watching this podcast, you work in healthcare marketing, perhaps, and for you, the last couple of weeks have been personal that way as well. It's
very hard.
It's a very hard thing. It's a very natural thing to feel, and it is paralyzing. I mean, we are evolved from a species that has the fight or flight instinct baked into us, and even though we've come a long way from the savannah and tribes of one another battling over the water hole, that fear or fight instinct still kicks in moments like this, and it saps your intellect. It saps your ability to think rationally, because all your body is telling you is get away or fight or whatever. And you have to have, as part of your sort of coping mechanisms, a way to ride that out, because it will calm down, and your intellect will come back. But boy, in those first few minutes, it can feel like the most awful thing ever.
Which is why having crisis plans in place and templates and the work that you do to prepare organizations and brands for these moments is so incredibly important. Yes. To have that safety net, that security, yes. that lifesaver, whatever you want to call it as the metaphor here, to help you get through those moments when you're still in shock and your mind is unable to really focus on the what to do.
Absolutely. That is absolutely a key. If there's one predictor in my experience of how an organization is going to come through an event like that, it is how well did they plan for it? How much effort did they put into creating a plan? How much effort did they put into keeping it up to date? How much effort did they put into practicing it? The more that answer is more, the more likely it is they're going to be able to do that, because it is paralyzing. In some of these plans, we literally put at the bottom of each page, turn the page, because we don't want to make people have to even think about that level. We want them to do it until that intellect comes out. And there's a momentum to it, right? If you can do the first three things on your checklist the fourth thing's a little bit easier.
Yeah,
And then
absolutely.
and then again, your intellect comes back and you start to be that person you are 99.9% of the time.
Absolutely. Again, as we go back to talking about how do we rebuild trust as an industry, something collectively we all need to own, and as marketing leaders need to own. There are a few things I wanted to point out that I think are important. We've touched a little bit on it. Transparency, I think, is incredibly important. Being upfront as much as we can about costs, coverages, limitations. People understand the system we have is complex and we don't always have all the answers. Therefore, people don't expect it to be perfect, but they do expect honesty and transparency. And so when the answer is we don't know, we have to say we don't know, right? And not let it be give appearance of sort of being hidden or getting a runaround type of answer or response. I also think we really need to focus and sharpen a bit around a patient-centric view of everything we do. Business decisions, marketing messages, right? So yes, it's important in your communications and your marketing materials to be thinking about things from a patient-centric lens, but broadening that out to business decisions as well. Shift the focus from what works for the system to what works for the patient. And the more that we can really prioritize those needs and communicate against those needs, I believe the more trust that we'll earn.
I agree 100%. You go back to the difference between relationships and transactions we were talking about at the beginning. The patient should be at the center. The member should be at the center of that relationship. And the framing is what does the member need to know? What's important to the member? How do I get that information to them so that when they need to make a decision, when they need to get answers to questions that have become urgent all of a sudden, they have a network around, they have a relationship around them that is built to provide those answers and support them. And it's, I think you touched on this. There are few industries in the world that are more complicated than the healthcare system in the United States. How we create and deliver healthcare in the United States is enormously complicated. It's mostly unplanned. It's mostly a product of decisions that were made for a specific issue years ago, and now have become sort of embedded in basically the industry. But it's just incredibly confusing. And when somebody has to walk into that relationship and be expected to navigate it as a member, it can be overwhelming. And so I think to your point about building trust and how do we improve trust, that's another way you can do it is, not only is it a relationship, but it's a patient member centric relationship.
Absolutely. Another thing that really stood out to me, Jon, when we were prepping for this conversation, you said something that this particular event has really touched a nerve in our society. And I wondered if you could elaborate on that point a little bit.
Yeah, I think, and again, I want to be very respectful and I want to be very cognizant of the fact that so much has been said about this already. But I think it's really, really important that we not lose sight that at the heart of this event is a young man who has become so radicalized and so twisted around the delivery of healthcare. And I don't pretend to know his story and how that happened, but he has become radicalized to the point where his response to that is to stalk and assassinate the CEO of the largest provider of health insurance in the country. And that says something that's really important and even important beyond the tragedy that's at the heart of that. And we have to pay attention to that because it says something about how the industry is perceived in society. And again, widen the frame a little bit. It's not just his action. it's how a significant percentage of the population is reacting to it as well.
Yes.
I've been doing this a long time, as your viewers can tell. I've not just come to this work, and this is the first time I've seen an event like this where there are people actively, visibly showing their face on camera, cheering this on. They're applauding, they're sympathizing, they're expressing admiration. I mean, it's incredible. Now, you said something up at the front that should also frame it. This is happening in a context of eroding trust in all sorts of institutions, right? So there is a larger societal issue in there, but it says something to me that about this industry in particular, that radicalization happened here and that response happened here. I think that's significant and not something we should lose sight of.
Yeah, I agree. I mean, there's definitely sort of a broader context, highlights a larger cultural issue, just the growing distrust in institutions overall, in government, in media, in addition to healthcare. It is a cultural moment where people are questioning who they can trust.
Yes.
So again, I think that is an important point of reference. The political landscape, the polarization, the erosion of trust is important as we think about how to navigate trust and reputations overall moving forward.
Right. And some of the traditional ways people decided how much trust to extend to an organization, those too are challenged, right? It used to be that the media was held in fairly high regard as sort of the arbiter of what's really going on,
right,
in this country. Right. I grew up in that model where, if it was in the paper, it was generally mostly even-handed, but it was, the reporter's best shot at telling you, here's what's really going on. Well, now, not only has that trust eroded, but the media has fragmented so much that you literally can pick your own news. You can pick your own interpretation of the news, and you can feel informed inside that choice. Even though somebody else might look at your choices and go, you have no idea, but they're also in a bubble too. So how do you bridge that? How do you create trust there when you have two people who may not even agree on what day it is, right? It's a real challenge for communicators, but it's also a reality too. It's not something you can ignore. How do you become that trusted source for information? And again, I think it goes back to something you touched on. It's by making that member-centric relationship important, and then walking that talk. And you can't just say it; you have to do it.
Yeah, this is reminding me of the recent episode we did with Paul Ratsky of Edelman, where we explored insights from the 2024 Edelman Healthcare Trust Barometer. So they do the overall Edelman Trust Barometer, and then they do industry specific around healthcare. And there's just a ton of great insights in that episode with Paul. I encourage listeners, if you haven't already dug into that episode, go back, take a listen. There's a lot, I think, that's relevant and applied within the current reality. I do recall one of the key findings was, as we've been talking about, trust in major institutions has not only eroded, but it has gone to the level where we've now fallen into distrust levels. And, to your point, Jon, about sort of trust in information that's coming from the media, Edelman found that the decline in trust is compounded by a misinformation problem, where contradictory medical information and changing recommendations really leave people sort of questioning motives, questioning what's right here, this or that, right? Like, I'm hearing two different sides. So which is the truth here? And another critical insight that came out of that report and conversation was the correlation between trust and empowerment. So individuals who feel empowered to make informed healthcare decisions experience better outcomes. And that alone as a finding really highlights, as we talked about earlier, the need for transparency and clear communication within our healthcare marketing. So again, just want to refer back to that episode. Take a listen. Paul and Edelman have a lot of valuable insights to share around that.
And I am so grateful for the Edelman folks for doing that survey, because they've been doing it for 25 years maybe. Yeah, and so not only does each year produce insights that are worth paying attention to, but you can look back over it historically and you can see trends, some of which that are speak exactly to what we're talking about here.
Absolutely. Yeah, I think the trend lines are really important to take a look at as well, not just the snapshot in time as you said. You also brought up the point about the role that insurers play in the industry, and we know that trust there has been fragile, and it's understandable to an extent, right? There's a bit of a perception gap there in our system today. Patients can feel like they're fighting for care in a system that they believe exists to support them, right? And so when we think about denied claims or surprise medical bills, right? Even when you're insured, it is those moments that are real, and they're part of the structure that actually happen. But it is in those moments when trust can be further eroded and leave people feeling a bit powerless, as it may be. So I'm just wondering if you have any sort of additional thoughts on rebuilding trust, any additional steps that you feel folks can take. And again, I don't believe this is about one person, one company, or one stakeholder group, but I do think it is important to call out the critical role that insurance companies do play within our system.
Yes, and I'll go back to a word you've used several times. It starts with transparency and clear communications at the front end of that relationship, and then all the way through. I think a lot of times, I see a lot of communications in this space, and then in other spaces as well too, that are written from maybe a legal perspective is unfair, but that's, I think, how a lot of people read it. They read it and they say, wow, this is a lot of legally gumbity gunk. And it's not that thing we were talking about. It doesn't tell the member what they need to know. It's not clear to them unless they happen to be a healthcare attorney. And it is, I think the overall impression is that sometimes it'll take away trust because they may not understand it, but they're sure some lawyer wrote it, and it's designed to cover the company in certain situations. So right from the very beginning, you're I think setting that expectation that you may not be able to trust these folks as much as you think you can when it really matters, right? Because this sounds like a lot of here's what we won't do kind of words, and I think that it really underscores the important role that communicators can play, professional communicators can play, in taking that language, which is important language, because you have to be clear. Here's what we will and won't do in our relationship, but put it in language that is accessible and transparent to those members who aren't lawyers, who aren't spending their time reading their end user license agreements in their software. They just want to say, when I really need you, I just know you're going to be there, and I know, and if there's sometimes you can't be there, I want to know that too. And I think that's an achievable goal, especially if you look at this less as a legal communication and more as a relationship communication between parties you're trying to establish trust with. Yeah,
absolutely. Yeah. Human, speak to me like a human, right? Yeah. Don't speak to me like, right, a legal team. Obviously, we've got to make sure we're checking all of those boxes and protecting the organization, but really try to humanize that language, human to human.
I think, and again, this is what I do for a living. It's what you do for a living. I think you can be both human and precise. I think you can communicate to folks, here's what this is, in a way that they go, I get it. Okay, thank you. I understand that. And still have the level of precision you need so that it doesn't create that ambiguity that keeps the attorneys up at night.
Yeah, I totally agree with that. I think we need to push ourselves as an industry to do a much better job of that. And it's okay if the message isn't necessarily what people want to hear, if it's the truth,
exactly.
and we're delivering it in a very empathetic way.
Yes.
Gosh, I would take the truth, the direct truth, even if it's not what I want to hear over a runaround any day. Any day.
I agree 100%. People can deal with bad news as long as they understand what the bad news is, and they have enough information then to make an informed decision about what to do about that. Okay, you're telling me this, I understand this, so now I know that if this happens, here's what I'm going to do about that. Or, you know what, now I understand that this choice I was about to make doesn't work for me. Is there another product, another type of coverage that will work better? Because here's my problem. And again, it's an interesting thing about communications. I find, having done this for so long, people take it for granted in the same way that they take for granted that the electricity comes out of the plug and the water comes out of the tap.
Sure.
Once it's almost like once the policy or the decision is made, they just assume, well, it'll get communicated. And it's in some ways, it's the most important part of communicating that decision or that policy is the most important part of the whole process. Because if you don't communicate it very well, you're certainly not putting your members first, and you're certainly not helping your company, because all you're doing is setting yourself up for a series of those apocryphal, anecdotal, awful moments. And we all have them, right? About healthcare coverage and things like that. We've all heard of the friend who heard of a friend who had a sister who did this, right? Those are out there. We set ourselves up for that as insurance providers when we don't communicate clearly. I think we make them inevitable.
Yeah, absolutely. A few kind of more quick fire type questions for you here, Jon, before we wrap. What would you say is one of the most important questions healthcare marketers should be asking themselves right now?
I think they should be asking themselves, what does this mean for my members? I think they should, that first step towards putting those members first, ask yourself that, not what do we need to tell them? What do we want them to know? What do they need to hear? I think if you start your conversation or your thought exercise from that, that's a good beginning.
I love that. And I think it's something we all know, but I think we have to remind ourselves of on a frequent basis. And this is that wake up call. It's the outside in, right? Not, to your point, it's worth underscoring, not what we want to say, but what they want and need to hear.
Exactly right.
For folks listening, what's one thing they can do starting tomorrow to help rebuild trust, not just only for their organization, but for the industry as a whole?
Well, I think, again, to go back to those anecdotes that we all have, and I would like, and I'm not just being plain to your audience here, I would like to hear more anecdotes of when the system works, when the system made a difference in somebody's life in a way that is meaningful. Again, bad news often leads the news, right? There for a reason, but there's a place for the good news stories too there. And I think all of your audience will know this industry does a lot of good. It makes it possible for people who wouldn't get access to quality care to have access to that quality care and make, not only changes in their quality of life, to literally save their lives. Sometimes that's, it's not a high priority because there's always something urgent, but boy, I sure would like to see more of those.
Yeah, I think that's such a great point, that we need to talk about our commitments on a broad level, but we need to also show progress against that, right? Like, even if it's this one thing that happened over here that made a difference, that made an impact for that one person, and it is a shining example of living up to the commitment that you've made as a brand, as an organization, and it gives us all hope that that could be my experience too. Right? We're moving toward a reality where that experience they had over here could be mine too.
Right. And remember, like all communications, right? It gets consumed by different constituencies, right? So those good news stories aren't just for the benefit of members, like here's how good we are. They're for the people working in this industry as well too.
Yes.
Who sometimes need to be reminded the work they're doing is important and it matters and makes a difference. And they don't have to look at their shoes and mumble when somebody says, "What do you do for a living?" You can say, "I do things like this," and honestly and sincerely, be proud of that work, because you should be proud of it. Because again, the story of this industry, as complicated and as messy and as unplanned as it is, and as expensive as it is, right? I mean, it's healthcare is like a $6 trillion business in the United States. With all of that, it still delivers healthcare of a quality that people come to this country for. So
yes, yes,
you don't ever lose sight of that fact either.
Yeah, I think that's a great point for us to end on. I firmly believe that as an industry, we are doing far more good than bad. It is why we are here. It's very mission driven, and we owe it to ourselves, our colleagues, but most importantly, the audiences we serve, the customers we serve, whether they're members or patients or whoever else in these stakeholder groups. We owe it to them to continue to tell those stories of why we wake up every day and do what we do, and the commitments we're going to continue, and even talk about the really gnarly problems that exist, and own it and acknowledge it and say, this is hard and we don't have an immediate solution, but we're working towards it. And here are just some small examples of some little steps we've taken towards that. Right. I think that sometimes in our world, larger corporations, being somewhat bureaucratic in the approach to communications at times, we don't let those stories out, or we can't find them.
They're the ninth thing on your to-do list.
Yes.
And your whole day is consumed doing the first 6 because they're urgent and they've got a faster deadline or whatever. Yes. And you're driving home and you think, I didn't do that thing. Well, that thing, that capturing that pulsar may not be the most urgent thing, but it may be the most important thing on your list. And it's just a function of our world that, those things end up as ninth sometimes.
And it's why we do what we do with our clients, because to your point, they don't have the luxury maybe every single day to focus on the more proactive unearthing of these stories. And, when our philosophy, and when we talk about thought leadership, we don't mean it in terms of promoting the organization and just making yourself look good. We mean it in terms of framing it from the audience, the patient-centric lens in the world. What are the problems that are keeping those people up at night? And what are your ideas for how to solve those? And what are you doing to solve them? And how can you be a steward in linking arms with other innovators and thought leaders to actually tackle some of this really gnarly stuff, so that we're not sitting here another 12 months from now saying, gosh, we really didn't make any progress on that key pain point that people have, but really owning that and being committed to being part of the change.
Yeah. And I'll echo that. When I was on the client side of things, one of the great uses I had of an agency was exactly that. Take them out of the firefight, give them a project that's really important, but needs consistency and constancy of effort, and say, I can fight the fires all day, but I need to know that you guys are also pushing forward this program too, because it's not as urgent perhaps every day, but boy, in the long term, it's just as important, if not more so. So I think that's a great way to allocate resources.
Yeah, absolutely. And a great way to wrap the conversation today. I again want to acknowledge the human toll of this tragedy.
Yes.
It is a sobering reminder of the stakes that we're dealing with in healthcare, not just for individuals, but for the system as a whole. Rebuilding trust isn't going to be easy. It's going to require a sustained effort, open dialogue, and a willingness to admit when we've fallen short. Thank you, Jon, for
No,
joining
thank
me
you, Sarah.
today.
Really, really a pleasure as always to spend time with you and do it on camera. Well, I don't usually do that, but that's lovely.
Well, thank you for being willing to do this, as I said, and thanks to our listeners as well for joining us today in this important conversation. If you'd like to share your thoughts or continue the dialogue, please reach out to myself or Jon. Jon, what's the best way for listeners to get in touch with you?
Website, jaustingroup.com. Jon at jaustingroup.com will get me. It's the nature of my business. You call, you email, odds are I'm going to answer.
He's got a red phone, and when it rings, he answers. I can assure you of that. Even if it's the 3 a.m. on Christmas morning, Jon will answer the phone.
Which nobody wants to do, but if you have to, that's what we're here for.
Somebody's got to do it, and Jon's the guy. Well, again, appreciate everyone for joining us today. I do believe that together we can work toward a future where trust is at the heart of everything we do, and I believe the future of healthcare depends on it. We'll see you next time.